It's a very sad death that I have to report to the people of Gibraltar. It's a death of a resident of elderly residential services. We believe that she was infected with the virus that was brought in by a visitor. That's what contact tracing tells us, which gave rise to that outbreak that we had in ERS services, in particular at the John Mack wing. It's very difficult to reflect on the fact that we've now been dealing with this disease now for a number of months, and it's now taken the Gibraltarian. It's taken one of our own, a lady who has been through the evacuation and the Second World War, who's been through a lot of suffering already, and we were unable to save her from contracting the virus and losing her life to it.
The last few days have brought hope with the development that a vaccine may be ready by the end of December, but you believe that this hope may be somewhat dangerous as well.
Well, look, I believe that the vaccine is the most magnificent news we've had. I think it shows us that there is hope on the horizon. We're now talking about a period of time which will be finite, beyond which we hope we will be able to put COVID in its place with all the many other diseases that we immunize ourselves against. But people need to understand two key things. First, that the vaccine is not yet available. It's not yet in Gibraltar, it's not yet in the United Kingdom, it's not yet available in the United States. It's going to be available, and as soon as it's available, it will be in Gibraltar, and we'll start to immunize in the same categories of ranking for our frontline workers, for our GHA workers, for our elderly, as will be established around the world as the right hierarchy, okay? The second is that we're talking about a vaccine. We're not talking about an antidote. In other words, if you've got COVID, giving you the vaccine is not going to cure you of COVID. So the rules about washing your hands, about wearing a mask, about keeping social distance, those rules are as important today, 48 hours after the vaccine has been announced, as they were the day before the vaccine was announced, because the vaccine is not yet here and the vaccine is not an antidote. And I can't emphasize that enough. Look, everyone will have felt the great sense of relief when the vaccine has been announced. Relief of what's coming, but not relief for today. And that's what I please urge your viewers to understand.
There are those who might accuse you of perhaps over-dramatizing the situation in order to justify being able to keep the controls on social distancing and in Main Street, etc. What would you say to them?
I have to tell you that the hardest thing I have done in the time since I have been Chief Minister is impose controls on mobility, impose a requirement for people to have to cover their faces. I want to see the face of every single Gibraltarian. The smile on their faces is what I am charged with ensuring continues to be the case with the work that we do. But there is no question of us wanting to control anyone's life. I stand for freedom, I stand for liberty. Gibraltar belongs to the Gibraltarians. The Gibraltarians should enjoy Gibraltar as much as possible. That's what I want. We're doing this because we have to. If you believe that COVID is not real, if you believe that we're doing this somehow in order to control you, then frankly, the next step for you is to believe that the earth is flat.
And you believe that the rise in positive cases that we've seen over the last few days is related directly to perhaps people going away for the midterm break?
So one of the things that we were very alive to was the risk that people would bring COVID back from Spain, because a lot of people didn't go to the United Kingdom for midterm this year. They went closer to Spain, and that they would bring COVID back. And look, we didn't order people not to travel. We had just asked people to be careful, and we asked them please to take a test when they came back, to get in touch with 200 41818 or 111 and tell them about their journey and try and get tested, and they would be tested. A lot of people have not got in touch with us, and we are concerned that what we're seeing now is people who've been away and who haven't got in touch with us who are now manifesting with the virus because they've now been tested after they become symptomatic. Please, I'm urging people to understand that the rules are there for a genuine public health reason, and that's why we're asking them to get in touch and get tested if they've travelled out of Gibraltar for midterm, if they're returning to Gibraltar from a university, or indeed if they believe that they've been out of Gibraltar and been exposed in some way.